doing the work day in and day out, and the employer just keep piling it on. And if, heaven forbid, if you don't do it to the speed of them, they will be calling you in for disciplinary meeting because you're not meeting their expectation, which is very shameful. Even as they actually need more hands-on care and time to recover. And yet the hospital management wants to implement more cuts. The hospital has been cutting jobs, and if you talk to Lakeridge, they will tell you they are not cutting jobs, but we know differently. They are cutting full-time jobs, and because in our collective agreement it says they can give us notice of elimination, which they do give us notice of elimination, but that language does mean when the job is gone. Well, we're in healthcare. The job didn't go anywhere. So when they cut these full-time jobs, what happens is the workloads get 10 times more onto the people that are there that are already overworked. So how can the employer see that what they are doing is not good for the patients, the clients, or their worker? But they keep piling it on, and when us, the union reps, speak up to represent our members and point them to the collective agreement that says, this is what you need to do, they turn around to us and say, oh, are you telling us you want layoffs? No, we're telling you to follow the collective agreement language properly. And if you do, usually, there's no one out the door. But what you're doing right now is against the collective agreement because you're laying off these full-time jobs and you're not replacing them. There's a problem. But Lakeridge don't see a problem, but there's a huge problem. So over the last, I would say, years, but start paying attention over the last year of all these full-time jobs that are eliminated with the notice, but the work is still there. The workers here that are in there, they are the ones that are bearing the brunt. You have visitors coming in, your patients, your clients coming in, they're pissed off. Guess who they're pissed off at? The workers. That is shameful. And the employers sit behind their screens. And when there's a complaint to the employer, they have the nerve to call us in with the members to give them discipline because of whatever the patients or their visitors say, because the workers are wrong until proven otherwise. So that is what our workers are facing day in and day out. They are struggling. We are asking the employer for help. They are not giving the help. The workers are afraid to speak up. It's not because they don't want to speak up. They want to keep their jobs, so they don't speak up. They're afraid of reprisal. And it is very shameful. And people like myself and Cindy, Lori, and all the other executives that are there, we do advocate, but this is the barrier that we, the workers and the union, we are faced with. And I just want to thank you all for coming out to this support. And at the end of the day, I just want to tell Lakeridge and the government of the day that our workers are not going to take it anymore. You'll see more of this rally. We're pissed off. I know we're healthcare workers, and we're told to behave ourselves and be polite and all of that. That shit's out the door right now because they're disrespecting us, and it's time for us to speak up. And for the ones that are afraid to speak up, we will continue to speak up and fight for them. And thank you very much for coming out. We have a bunch of speakers, so I will start off. First speaker is Sharon Riche. She is the OCHU Ontario Council Hospital Union Secretary Treasurer. Sharon.
Thanks very much, Pam, and thank you very much to the local 6364 for arranging this and bringing light to the issues that are happening inside the hospital. But you know, we're awfully quiet. We're awfully quiet, so why don't we start with a chant? What do we want? More funding. When do we want it? Now. What do we want?
More funding.
When do we want it?
Now.
What do we want?
More funding.
When do we want it?
Now.
You know, we're all gathered here today. It is a beautiful day. because healthcare in this community is really at a breaking point. And what happens here at Lakeridge Health, Oshawa, is a clear example of what is happening across the province. This isn't just about one hospital, folks. It's about a system that has been stretched too far for too long. It's about patients waiting in hallways. It's about staff working short, skipping their breaks, still giving everything because they deeply care about the patients they serve. It's about a decision being made that puts the budget ahead of people, and this is shameful. Here in Oshawa, we're seeing the consequences of chronic underfunding, staff shortages, and increased pressures on our frontline workers. Beds are full, emergency rooms are overrun, and yet every single day you all show up to care for your patients, and you should be pretty proud of that. We need real investments into our public hospitals, not cuts, not closures, not privatizations. We need staffing levels so that healthcare workers can provide the care that they've trained for. And let's be clear, healthcare workers are being pushed to the edge. And when that happens, our patients are the ones that are going to suffer. And none of us wants to see that. So, today, I think we're here to say, Doug Ford, you need to listen to the frontline workers. You need to start listening to the patients that are in these hospitals. And you need to start listening to the communities. Stop managing crisis and start building a system that actually meets the needs of our communities and the patients within the hospitals. I just want to say thank you very much for all of you coming here today, and let's just make some noise so they know we're out here. What do we want?
More funding.
When do we want it?
Now.
What do we want?
More funding.
When do we want it?
Now.
What do we want?
More funding.
When do we want it?
Now.
Thank you, everybody.
Thank you, Sharon. Next, we'll have Melissa Lawton, Area 4 Vice President.
Good afternoon, everyone, and thank you for attending this rally. My name is Melissa Lawton. I am a full-time RPN working in a rural hospital emergency department in my 35th year of nursing, although I don't look that old. I am the VP of Area 4 OCHU, which is the Ontario Council of Hospital Unions, and in my role I sit representing the communities of Campbellford, Cobourg, Peterborough, Lindsay, Oshawa, Bowmanville, Port Perry, Ajax, and Whitby, where we meet monthly to discuss what's going on in each of our areas. It is with this belief that I have come forward today to stand here and defend our right to publicly funded health care. Our hospitals continue to serve public with hallway medicine. Our hospitals continue to run short-staffed. We fill our hallways more and more with patients, but they don't hire more dietary staff to serve these patients, nor do they hire more cleaning staff to clean for these patients. We continue to fill out workloads as they continue to push us to do more with very little or nothing left to give. AI, such a wonderful thing, is taking our clerical positions away. Kiosks swiping in patients, taking our clerical work away. Two-tiered healthcare is the biggest threat to a universal medical care system. Doctors will be able to charge unlimited fees for not-for-profit, and these federal MPs do not fight for a publicly funded healthcare is a travesty. Doug Ford wants to close hospitals, wants to privatize services, and wants to create for-profit hospitals. Hospitals have been told they'll get a 2% funding increase. What the heck's 2%? Well, it's well below the 6% increase in their expenses, so we know what's coming next. Find efficiencies, reduce costs. We all know what that means. Cut staff, reduce services, come after our jobs. North Bay, Toronto, Markham, Hamilton. Hundreds of jobs eliminated at North Bay Regional Health Centre. St. Joseph's Hamilton, Hamilton Sciences, and elsewhere. This is just the start. This will create 2,400 bed closures by 2027-28.
Shame.
We will continue to have rallies to show the Ford government that we will continue to fight for our publicly funded hospital. It is our healthcare right. We cannot let this happen in our province. We cannot let this happen in any other province in Canada. This is to be a strong mandate to our government that this action must stop, and we must preserve our publicly funded universal medical care system. Thanks for your time, and thank you for coming out with great support.
Thank you, Melissa. Next we'll have Lisa Barker. She's the president of CUPE Local 1943 Peterborough.
Peterborough.
Thanks, Pam. Good afternoon, everybody. How are we today? So we're here obviously because we know that there's important things going on. Today at Lakeridge, we can see the real impacts of the chronic underfunding. And it's our workers and our patients who are paying the price. Reports have said that in the Durham region, we're going to be losing frontline jobs, healthcare, and beds that we desperately need in this community. These cuts aren't happening because the work isn't there, like Pam said. They're happening because the funding isn't keeping up with the rising costs. These layoffs are not about the lack of need. They are about the lack of political will. Hospitals are being told to do more with less, and as wait times continue to grow and hallways filled with patients, hospitals are being forced to balance their budgets instead of meeting the growing demands of our communities. That means fewer frontline staff, fewer beds, and longer wait times. It means healthcare workers are stretched beyond the limits they're already stretched beyond, and patients are receiving care in the hallways instead of in proper spaces with dignity. Meaning fewer frontline. I lost my spot. Ontario is spending less per patient than any other province, and we'll be relying more on privatization and short-term fixes. That approach does not strengthen our system in any way, shape, or form. In fact, it weakens immensely, and we know it doesn't work. We've seen this elsewhere. This isn't sustainable, and it's certainly not safe, and it's not fair to the workers who show up every day or to the communities who rely on us. Healthcare is a public good. It should be properly funded, fully staffed, and publicly delivered. Healthcare is not a luxury, it's a right. And we must stand together to demand the funding, staffing, and respect our system needs. And together we will keep speaking out, because when we defend public health care, we defend our communities. So because we can fight for health care, we fight for everyone. Thank you.
Thank you, Lisa. Before, just in case people are leaving and stuff, also I'm a part of the Ontario Health Coalition, the Durham chapter, the Durham Health Coalition. I'm co-chair with Lance Livingston here for Durham. We have flyers here, and I will mention it at the end again. We have a big rally coming up on May the 28th. It's called Go on the Train, and the seats are already paid for. We need individuals to sign up so you can get your seats. So we have the poster, the rally, and the information in those leaflets. If you need some, could please just help yourself. They're right there. And the Health Coalition is the ones that go around along with our Ontario Council of Hospital Unions that fight for our public healthcare system. So this, we're promoting that hopefully you talk to your friends, your neighbors and all. It will be May the 28th at Queen's Park. We're marching from Union Station up to Queen's Park. So the ride is already paid for. We just need your body to show up. Thank you. Next we have Kevin Cook, who's our Ontario Council of Hospital Union First Vice President.
Thank you, Pam. We are here today because something is deeply wrong, and we refuse to stay silent. Across this province, there's been over 700 jobs eliminated. North Bay, Hamilton, Stratford, Toronto, here in Oshawa and Ottawa. And that is more to come. We can see what this government is doing. That is just not a number. Those are nurses, porters, dietary aides, clerks, real people who care for our communities, our families, and the people that visit this hospital daily. And while those jobs disappear, this government stands in front of cameras and says everything is fine. Everything isn't fine. Hospital needs at least 6% funding to increase just to stand still, just to keep the lights on, just to maintain the care people already depend on. But instead of stability, we're seeing cuts. Instead of support, we're seeing strain. Instead of solutions, we're being told a story that doesn't match reality. Let's talk about the reality. Emergency rooms are beyond or at full capacity. Patients are waiting at least 19 hours or more to be admitted. Hospital ER closures are still happening to this day. Not because it's not needed, because there's not staff or proper funding. And here is the truth. You cannot cut your way to better health care. You cannot lay off workers and expect shorter wait times. You cannot starve a system and expect it to be there. This government promised to end hallway medicine, but today, patients are just in hallways. They are waiting endlessly, suffering and pain, and sometimes not getting the care that is needed or deserved. That is not progress, that is failure. When we are the ones holding their hands at 3 o'clock in the morning, we are the ones trying to do more with less. We are the ones that go home exhausted, knowing we've given everything we have, and sometimes worry that's not enough. Because we care. We are healthcare workers. That is why we are here. We are just not workers. We are also advocates. We are the voices of the people lying in these beds in these hospitals. We are the voices of these families waiting in emergency rooms and for surgeries. We are the voice for a system that is being pushed to a brink. And let's be clear, we are not going anywhere. We will continue to speak out, continue to stand up, and continue to demand more out of this province. Because the fight is not just about us, it's about every person who will need this healthcare system. And that means all of us. So today we will send a message. We will see what is happening. We will not accept it. And we will fight together for a healthcare system that actually this province deserves. Thank you very much.
Thank you, Kevin. And Kevin touched on something that I know that most of us healthcare workers already know, but the public doesn't know. All-way medicine. You used to walk in and it's in the merge doors when you walk in. Well, the employer got a little bit I won't even say smarter, but they got a little bit more creative, and now they bring those patients up to the floors and put those patients in the hallway on the floors. And yesterday we found out, this is not telling stuff that didn't happen, we found out by accident at a meeting that, we bring the patients up to the floor, say, I'll pick a floor, say the 4th floor, and they don't belong to the 4th floor. Well, who does those patients belong to? We're still waiting for the answer. We know who the patients belong to. They would belong to the 4th floor, right? But they're hiding behind these. They have these all-way medicine, and this has to stop because patients are suffering. They're on these hard stretchers, and it doesn't matter where you want to put them, it's not right. But you put the patients up there, you need the staff to staff them. And at the end of the day, we all have to come together. Next on our list is Peter Vosh, our retiree.
Thank you, comrades, and a lot of you have spoken very, very, very well so far. So I'll just identify myself and say a few words. My name is Peter Vach. I'm a retiree, CUPE retiree from Local 7797 Health and Social Services. And my local is from Toronto, but I live northeast of Peterborough right now. I'm part of the Peterborough Health Coalition, and I'm also part of the CUPE Ontario Retirees Network. And big up for them. And I'm part of Congress of Union Retirees of Canada also. So big up for Kirk also. And I encourage retirees to join us. But what I want to say here is people have talked about the cuts, and you've spoken really wonderful. And maybe from a retiree's perspective, there's a lot of things that you can say. But this is an issue that's been in the craw of the rich and powerful for a very long time in this country. We, workers, we won this. It's not just Tommy Douglas, it's unions. It's union folks like us who came out to fight for Medicare in the 60s when we had two lines. One for people who could afford care and one for the rest of us. And we said there's only one line for Medicare, and that's who is sickest. And that matters. That means it doesn't matter how much money you have, whether you're a manager or you're a worker, there's one line. And that one line means that the sickest gets the care. That's in their craw right now. And I know it, I can feel it, we've all seen it. And that's what they want to get rid of. They want to recreate the two lines.
Yes, they do.
And I hate to say it, I live in a beautiful lake community with wonderful neighbors, and a couple of them are bank managers. They're nice people. However, I did say I'm coming to a demo like this. And you know what the response? I said, we're fighting against privatization because they want to introduce for-profit for money into the system. And my neighbor, wonderful person, said, what's the problem with that? What's the problem with that? I can afford it. That's the problem with that. That's the problem, and that's what we're fighting for. And on a parting note, comrades, I just want to say, I came in a car with a wonderful sister, yes, I'm pointing at you, from OCHU, Sister Betty Cree, retiree from Fleming College, another fight that we're involved in next week, cutting back the colleges, destroying our college system, destroying our public services bit by bit. And when we bargain together in the House of Labor, I'm a CUPE member since 1984. So I'm a loyal CUPE member, but I'm also loyal to the labor movement. I'm loyal to Unifor, I'm loyal to OPSU, I'm loyal to every trade unionist that stands here, right? We happen to be in one union or the other, but we shouldn't operate in silos. We have to fight together. If we want public support, if we want the community to support us, we can't say, oh, you can't go, you don't want to go to an OPSU demo where it's Unifor over here and UFCW or CUPE. We got to fight together. We have a common front and a common interest. We organize the same folks, right? We're all in the same industry, especially OPSU and CUPE. So let's fight together, common bargaining tables. Let's find a way to stand together against the employers and the governments that back them, like Doug Ford. Thank you very much.
Thank you, Peter. Next, we have Charlene Van Dyke, co-chair. She's also on our executive, but she's here on behalf of the Healthcare Workers Coordinating Committee. Charlene.
Thank you, Pam. So yes, as Pam said, my name is Charlene Van Dyke, and I am the co-chair of CUPE Ontario's Healthcare Workers Coordinating Committee. We represent over 60,000 healthcare workers across the province. I am also a proud member of CUPE Local 6364 and an outgoing member of its executive, and I am also responsible for compiling the workloads. I will get straight to the point. Shame on this employer for cutting jobs from one of the lowest paid classifications and offloading that work onto other classifications simply to save money.
Shame!
By eliminating dietary positions and assigning meal delivery to unit staff, the employer demonstrates a profound disconnect from the realities of the frontline care. Unit staff are registered practical nurses, our PSWs, personal support workers, and more. But today, I'm going to focus on these classifications. These are the workers responsible for timely medication administration, toileting that preserves patient dignity, bathing, comfort, and day-to-day care that supports and promotes healing. These staff are already overworked, already burnt out, and already exhausted. Many work short, many miss breaks, and give everything they have day after day. Adding meal delivery may seem insignificant to those who do not work on these units, but to frontline workers, it represents yet another task piled onto an already unsustainable workload. The result is more burnout and more workers feeling used and undervalued. The workload data tells us a troubling story. 77% of the workload submissions that I compile come from RPNs and 12% from PSWs, and even that only offers a partial picture. Many workers are simply too tired, discouraged, or too busy to submit workloads at all. We must stand up to this employer and be absolutely clear. Balancing budgets on the backs of frontline workers is unacceptable. Patient care is not where cuts should be made. If the employer is serious about quality care, they must stand with healthcare workers and demand proper funding from the government so that our hospital can deliver the care that patients and the people who provide it deserve. Healthcare workers are not the problem. Chronic underfunding is, and we will not be silent while patient care and worker well-being are sacrificed to save a buck. We need to stand together in strength and solidarity today and always and demand better for our staff and for our patients.
Thank you, Shirley. Next, we have Michael Hacklin, President of the UIT Faculty Association.
Thank you, everybody, for coming today. As Pam said, I'm Michael Eklund. I'm President of the University of Ontario Institute of Technology Faculty Association, representing about 300 members there, full-time faculty members. I'm here to show support from the broader public sector unions. Your fight is our fight. And we're seeing the same kinds of things in the public sector, secondary school, post-secondary education sector, with cuts that we've seen, especially in the college sector, our colleagues there. At the university, we're seeing this play out in other ways in terms of attempts to privatize things, attempts to bring in students with very poor programming. We're seeing larger class size, a dilution of the quality of the educational experience for our students. It's so important what you're doing as unions and nurses and staff here. We really appreciate that. As I say, your fight is our fight, and we're going to keep supporting each other, I hope. Thank you. Good luck.
Next, thanks, Mike. Another Michael. Next, we have Michael Hurley, who is our Ontario Council of Hospital Union, OCHU. Michael.
Thank you. Thank you so much for your activism. Thank you for coming here today. What do we say about a government that spends $100 million on TV ads telling the public what a great job it does on health care, while the Ottawa Hospital, with a $95 million deficit, lays off 400 staff? What about a government that buys a private jet for $26 million, while a hospital with a $19 million deficit lays off 100 staff? And here, and in Markham, and in North Bay, and all across Ontario, this is happening. We've had, since the beginning of the year, about 20 rallies like this. We have another 10 scheduled, but I would say to you that healthcare workers now have to consider stepping up this fight on behalf of the people inside. We have to become even more dedicated, even more militant, because what is happening to the degradation of care for people on those stretchers, in those beds, in those hallways, in those broom closets, what is happening is they are not getting the care that they deserve. They're not getting the care that they need, and it is crippling our frontline membership in terms of the emotions they carry home of failing to care for these people. And it's not them that's failing people here. It's a government cutting staff over and over again. A 2% cut this year in the real budget for this hospital. A 2% real cut last year. Thousands of jobs eliminated. Thousands, and the plan is to eliminate another 20,000. And the question for all of us is, are we going to allow that to happen? Are we going to allow that to happen? Are we going to act? Are we going to fight? Fight! Fight!
Thank you, Michael. So we're coming to a close, which we're at a close. So I will wrap it up again by saying thank you all for the support. The members that are in working, they appreciate it. We have all of the Durham Hospital. We picked this site because it's more convenient for most people. And I just want to say thank you for the support. Once again, the Durham Health Coalition, there's the stuff for the May 28th rally. If you need information, Lance and myself or contacts are on there. If you sign people up for the train, it's going fast. In Durham, we have 150 seats, and they're filling up. So if you want to get on the train, you need to go on the website, contact us so we can add you to the list. Once again, thank you, thank you, thank you. Have a good rest of the day.